Welcome everyone to our Tobacco-Free Tuesday webinar. Happy spring. I am Gina Roberts, the Virginia Department of Health's Tobacco Control Program. And on the screen, you will see our regional coordinators, Sarah Burkhead from the Central Region, Nicole Mann from the Eastern Region, and Tiffany Eustace from the Northwest Region. And so we just really welcome you all today. And I'm not going to introduce Rita quite yet, but we'll be doing that later because she is our speaker today, and we're so glad to have you here with us, Rita. We are going to ask a few questions so that we can get to know who is on the call and what you know about our current quit line. So what year did Virginia's quit services start? 1964, 1992, 2004, 2005, or 2009? Who really knows? I know there are a couple people that will probably definitely get this. Jane, I know you're on, so you will get this question, but how many others know the answer to this? (2004). Okay, the quit lines started nationwide in 2004 and were in all states, 50 states by 2006. But Virginia's actual date was 2005. So we started in 2005. No one hit the 1964, 1992. That's when California first started the first quit line. And then 2009 is when we introduced the Family Smoking Prevention and Tobacco Control Act. So very good. Now we have a couple more just to know where you are right now with quit line services in your organization. And there are two questions. You may have to scroll down. So is your organization a registered Quit Now Virginia referral site? Yes, we refer all the time. Yes, but not sure staff remember how to do it. No, we don't work one-on-one with clients. Not sure, not yet, but we plan on being one by the end of the day. So definitely, if not yet, please plan on being one by the end of the day. And then the second question, how excited are you to hear about the expanded reimagined Quit Now Virginia services? So very excited, pretty excited, but you didn't realize you were excited until you're here right now. Sarah, by the way, comes up with all of these things and I just love them. So. Take a couple minutes or a second, another second. No minutes here. Okay, very good, very good. Okay, yeah, I like the yes, we refer all the time, and we definitely work with people that we're not sure who exactly, or the staff that doesn't just have it in their system to do all the time. Not sure, 25%. And how excited? Let me scroll down a little bit. So 50%, half of you are very, very excited, and the other half are raring to go. We're ready for you. Okay, so thank you for answering those questions. And let me go ahead and introduce our speaker, Rita Miller, who I don't think I really need to introduce because she's always been, at least I've always worked with her at in our program. But let me go ahead and introduce Rita. Rita is the Tobacco Use and Dependence Treatment Coordinator for the Tobacco Control Program at the Virginia Department of Health. She is responsible for the coordination of the Quit Now Virginia services. Rita is also a longtime member of the Tobacco-Free Alliance of Virginia, where she serves as a coalition's membership chair. She has been with the Tobacco Control Program since 2012. Does it feel like that long, Rita? She's been here forever. And in that time, she has coordinated and introduced many new and improved services for Quit Now Virginia. She holds a BS from Johnson C. Smith University and a certificate in nonprofit management from Virginia Commonwealth University. She is a Virginia Coordinated School Health Fellow and a tobacco treatment specialist. And this is something you may not definitely know about Rita, but she recently published her new book, Determined Destination: Life's Imperfect Journey of Learning and Love. And if you have not read it, go out, get the book and read it. You will definitely love it. Rita's a pretty amazing person, and thank you so much for joining us today. And Rita, I will turn it over to you.
All right, thank you, Gina, and thank you to my amazing team for allowing me to come and share today. We have worked so hard over the last 15 months trying to bring these new services to you. And I really appreciate the support that my team has given me in working through and walking through this, because it hasn't been necessarily an easy task, but it's one that we wanted to do and we wanted to bring to you. So thank you so much for having me. I am so excited to be here this morning. I just want to say happy Tuesday to everyone. And I'm excited that 50% of you are excited about being with us. And hopefully by the end of this, the other 50% will be excited and will also be participating in our Quit Now services. So we're going to focus on two things today. One is we're going to talk about the special and, well, the improved and new services for Quit Now Virginia. And then the other part of it is we're going to talk about the referral sites, because that is what this is about. That is what we want you to know more about and be comfortable in doing with your patients. I don't want to assume that everybody here knows all about Quit Now Virginia, because many of you filled out a form, you sent it to me, and I put your information in, and you've been referring patients. But that doesn't mean you know what Quit Now Virginia is. You know you refer people, but you don't really know what the services are and how they work. And so we're going to start out with something I call who, what, when, where, and why. And who, what, when, where, and how, I should say, because I want all of us to be on the same page. I want everybody to know what Quit Now is about. So when you think about it, talk about it, share Quit Now Virginia, I want you to be able to share the right information about, and all of the information, not necessarily that you can refer your patients to the Quit Line, but certainly this is what the Quit Line is about. So I'm going to begin to share my screen. And we're going to get started. Can everybody see? We're good?
Yes, we have it. Yes.
All right. So we're going to talk, as I said today, about the reimagined services. But first, I want to talk about who these services are for. We begin to offer Quit Now services for anyone that is the age of 13 and up. If they need cessation services, they're eligible for those services. And we start at 13 because we know that tobacco companies are always targeting our youth, with not only with tobacco, combustible tobacco, but also we know now vaping is a huge issue. And so we want to be there for our young people. You don't necessarily have to be a tobacco user to call the Quit Line or contact the Quit Line. You can contact the Quit Line just because you want some information about the services we provide. If you are a healthcare provider and you want to just get basic information about how to work with your patients, support your patients, you can call them for that. If you are a concerned family member, you have friends, family, coworkers, or whatever, who you believe could benefit from the services of the Quit Line, then certainly you can call. And if you just want materials about cessation to have in your workspace, in your clinic, or whatever, you are welcome to call the Quit Line. What? So most of us know about Quit Now Virginia, but I'm wondering how many of you know about the Virginia Tobacco Control Program. We are partners. The Quit Now services are partners to the Tobacco Control Program. And the Tobacco Control Program basically is to support our communities with systems, environmental, and policy changes. And in doing that, most of the time, many times, that have people understand the need and the necessity to quit using tobacco. And so that's why we have Quit Now Virginia. And so Quit Now Virginia provides tobacco cessation services through phone, text, dashboards, and group sessions. And we're going to get into all of that later, but that is what Quit Now Virginia is about. Also, we provide nicotine replacement therapy, there are educational resources, referrals to communities, and free promotional resources. And so all of those things are what we use to promote Quit Now Virginia. The Quit Now services are available 24 hours a day, 7 days a week, because we never know when an individual may want to or make the decision within themselves to quit using tobacco or quit using whatever tobacco product they may be using. I mean, it may be 9 o'clock at night, it might be 3 o'clock in the morning. We want them to know that the Quit Line is available to them. The only days the Quit Line or Quit services are unavailable is our Independence Day, Thanksgiving Day, and Christmas Day. It's only 3 days in the year when the Quit Line is basically closed. Any other time the Quit Line is available. We serve citizens of Virginia. If you live in Virginia, you're 13 years or older, you are eligible to use Quit Now Virginia services. We know some of you may serve patients that live in border states. People come over, cross the line and come into Virginia to get their services. They still can be referred to the Quit line because every state in the nation has a Quit line. So even though you may refer them, they will get their services from the state in which they reside. So don't let that not allow you to refer patients because they don't live in Virginia. Still do that because their state will offer them Quit services as well. And we provide these services through trained Quit coaches. These coaches use motivational interviewing to help their participants or their members now to create a Quit plan. These Quit coaches take 240 hours of training. They also are trained in other specialized areas such as youth coaching, behavioral health, pregnant and postpartum. And so they are very prepared to work with the individuals that you send to the Quit line. So we're going to talk more about how this is done because we used to do web-based services. We always had our phone service, but that has been enhanced now. We have our e-referral system and that has been enhanced as well. So let's move on to the reimagined services. On February 1st, about 5 or 6 weeks ago, we changed to these new reimagined services. That's when everything launched. That's when they launched for you. But here at Quit Now Virginia, we've been talking about and working through and trying to make this happen since probably late 2021, because it takes time to make these huge changes. And one of the things we did with our Quit line vendor, who was Optum and now who is RVO Health, we had many conversations with them about changing these services. And what we wanted to do is to make the decision to switch to a database that would modernize our online platform and our overall services, because we believe that it was important that we give people the services that they need the way they were accustomed to getting services. So now, as I said, we're now with Rally Health. We used to be on a platform called Apollo, but we have changed to Rally Health because they were able to provide for us and our patients or our members a behavioral health platform that empowered them to take control of their own health. We wanted people to be more participatory in their own health. And so that allowed us to provide an interactive and tailored coach-led peer support session for them. And as we go through this, we'll talk about how those sessions will be. We felt it necessary because we were using, or will be using, the Quit for Life evidence-based nicotine replacement model. We wanted something that will allow a customer-centric behavior change coaching. And we also wanted that to have advanced technology. And we wanted to provide the capability for a better interactive online journey experience, because that's how we do pretty much everything in our lives now. That's how we shop. That's how we communicate with our friends. That's how we communicate at work. So why wouldn't you get your Quit journey in that fashion as well? And as a result of that, we're using the Quit for Life approach. It allows for us to have a personalized expanded digital-based way of quitting. So not only do we do telephone calls, so now we can text, now we can chat, now we can do group videos. And then we have streamlined the online enrollment process and make it easier for people to want to continue with their Quit enrollment. There's new terminology now that we need to be aware of. Before, we were always talk about the Quit line, and I've been using Quit line and Quit services back and forth here today, because I still, in my head, I'm still trying to work to Quit services. So forgive me for that, but that's just where we are. But we're calling them Quit services because it's no longer about a phone. It's no longer about just the web-based and the phone services. Now we have other ways of people engaging with Quit services. And so we're calling everything a Quit service now, no longer the Quit line. We used to call the individuals who signed up or referred to the Quit line or Quit services as participants. Now we're calling them members, because as a participant, that's something that you do. You did you did your journey to quit. Now we want you to be a member. We want you to know that you want the members to know that they are a part of a community of other people who are quitting, especially those who will be participating in the online group sessions. They will know that they are all together and they all belong to this quit journey together. And so we think that this is a better way to identify them. We're no longer calling it a coaching call. Now we're talking about sessions, because these are sessions that you're having with your quit coach. It's no longer a call on the phone. Now we're talking about many ways that they can interact with their coach. We're no longer talking about a web coach. Now we've gone to a dashboard, because we know that some people like to do things in a more advanced and fun way. So we now have videos, we now have all kinds of interactions so that they can ensure that they can get the journey that they want, or create the journey that they want. Also with the dashboard, it's going to be easier for people to engage with other people. We also have the opportunity for people to track their own journey. They will know themselves how well they're doing, and the dashboard can interact with them to let them know what they need to do to stay on the right path. So what's included in these services? If you would recall, if you've been with us for a while, you know, we had the 1 call, we had the 10 call, we had the 4 call, no more of all of that. So everybody now is eligible for a multiple call, one-on-one coaching session with their coach. And so you can do that by phone, you can do it by chat, you can do it online. And as I said, everybody has a multiple call experience with the quit services now. We're going to get deeper into that in a minute. Everybody now is eligible for group coaching sessions that is moderated by a coach, so that therefore they can be online in a Zoom kind of situation with other people, probably from other states who are quitting as well. And so I think that's going to add a lot to the experience of coaching. People are still, or members are still eligible to call the quit line whenever they need support, whenever they need to talk to their coach, and they can do that by texting, online chat while they're in the program. As you know, it's still 24/7 whenever they want to. We talked about the dashboard content and it being on demand when they need it, when they want to get to it, and when they have the time, because everybody has life going on, other things going on, and some people want in-person classes to go to, but they just can't do that. So between the dashboard and the online group coaching sessions, they can get a better experience. And one of the things I'm most excited about is this text messaging program, which is in the moment. We've had texting for a good little while. I think we started that program in 2018, but it was kind of one way. The coach would text you and then you could text them back. But now in the moment, if you need to get in touch with your coach or get in touch with quit services, you can do that through texting, chat, or whatever. So we're very excited about the way that we enhance these services so people can get a better experience. We're also continuing to offer nicotine replacement therapy, and of course that is through a coach support. It is now direct mail order, so members can order their own NRT based on what their conversations have been with their coach. They're eligible for either 2, 4, or 12-week shipments of patch or gum, and even one of our population groups is eligible for combination therapy, and we're going to talk about that in a few minutes. So to break this down a little bit further, when we talk about these multi-sessions, one-on-one sessions, all right, so everybody is going to get at least the 5-session plan. We're going to call it plan. All right, and so with that, you get 3 one-on-one coaching sessions, be it by phone, chat, or text. And then you're also eligible for 2 coach-led group sessions. And so that allows you to get your 5. You get your 3 one-on-ones, however you want to do that, but then you can participate in the 2 group sessions. Now, you don't have to participate in the group sessions. You may not want to sit around online and talk with a group of other people. That is totally your option, or totally their option, but it is available for you. The online dashboard is for upgraded experience. If you one of these people who like to play games and be interactive, and you can see your action steps, you can see the articles that are available for you to learn more about what quitting is about and how I can do it better. You can track your progress. All of that is now available to you through the dashboard. So just as a quick recap, there's still text to coach, which is an upgraded interactive experience. You can get your NRT online, order it yourself. The youth program, we're no longer doing it by phone because that phone was just not working for our young people. They don't talk on the phone. They don't even talk to us, their parents, their friends, their anybody. Everything now is done through an online, some kind of content. And so we've moved in that direction for them. And everybody will receive digital materials. If we have an email address, the digital materials will come to them through email. If we do not have an email address, then that will go directly to their home by mail. So this is how we are identifying our program now, or our services now. It's either Coach or Coach Plus. No longer is the 1 call, the 10 call, the 4 call, the 7 call, whatever. We're not doing that anymore. It was just too much. So we've streamlined all of this so that we know exactly who gets what, depending upon whether they're Coach or Coach Plus. So I want you to focus your attention to the far right column where it says Coach. And that is formerly the 1 call program. And that was for anyone, or is for anyone who is insured and 21 years old. And so they are eligible for the 5 sessions, at least 2 weeks of NRT. Some individuals, depending upon their tobacco usage, may get 4 weeks of NRT, but they are eligible to receive patch or gum. That is insured and 21 years old. Now, if we move our attention to the left column and the center column, and we go down to uninsured and 18 to 20-year-olds, this is a Coach Plus program. Everything now on is going to be the Coach Plus program, or Coach Plus services. They too are eligible for 5 sessions. They too will receive NRT, but they receive 12 weeks of NRT, patch, or gum. If you're pregnant, or the pregnancy, postpartum services, that is 7 sessions. And so let me explain about the 7 sessions. If you are in a 7-session program or plan, you get 5 one-on-one coaching calls and 2 online group sessions. As you can see, they just get 2 more coaching calls, 2 more coaching sessions. This is new. We're now offering NRT for pregnant and postpartum individuals. So they get 12 weeks of NRT, but it has to be administered only by a medical override. So a physician has to approve those NRT being sent to a pregnant or postpartum member. They also receive patch or gum. Behavioral health, that is anyone who self-identifies as having behavioral health conditions, they too get 7 weeks, but they are eligible for 12 weeks of combo NRT, which means they can get all patch if they want for 12 weeks, all gum, or they can get patch and gum. So that is for our behavioral health members. And our youth support is their online dashboard. They are also welcome to chat with a coach, but we do not offer NRT to our young people. Now moving on to the referral portal. The referral portal has been enhanced. I've had people to call me or either send me an email and say, Rita, the portal looks different. Yes, it does. It looks a lot different than what we were used to. The portal was available at the time that we launched on February 1st. If you are still using Fax to Quit or a fax referral form, that we have a brand new branded fax referral form. If you want the new form, I'll be happy to send it to you. However, if you have the capability of using the portal, I would strongly encourage you to do so. We've streamlined everything for efficiency so that it is easy not only for you as as a referrer or the person referring people to the quit line, you can certainly continue to do that, but hopefully it is easier for you. We've improved the field so that you can find yourself. As for the outcome reports, of course, we are still offering those. You can receive it by fax if you want it. Very soon, you should be able to receive it also by secure email. That is not available yet, but as soon as it is, I will let you know. And if you don't want to report, you don't have to get one. I would encourage you to get a outcome report on your patient, but if you don't want one, you don't have to get one. Also, in this time of telehealth and various and sundry ways of connecting with your patients, they can also text consent to use or to be referred to the quit services. And so we want you to be aware of that. Also on the portal, you can identify yourself by your NPI number for your site. If you know that number, you can put that in. Your site should come up. But of course, you can track by your name and by your address and your phone number and what have you. But the NPI number also allows us to clear extra data that we have on your site or either remove any duplicates. So we've been back and forth on this about this referral process and how long does it take for the quit services to get in contact with your patient. And so now the drop dead time that I've been told, and I'm passing on to you, is within 24 hours. And it makes sense for it to be 24 hours at this time because now we have various and sundry ways that we can get in touch with people. So we can do text, we can do chat, we can do phone. And so it shouldn't be a long process to get in touch with your patient once they are referred. Several attempts will be made to connect with the individual that you have referred to the quit line or to the quit services. We want the member to enroll in the program. That is the goal. And we want them to complete their first coaching session. So I am going to try to get us to the portal so that we can see how this works. Can you all see this? Somebody let me know.
We're still seeing your presentation.
All right, let's see if we can go a little bit further. And because I really do. How about that?
Yes, we see it.
All right, so let's look at the portal. All right, this is the new portal. And as we know, it looks a lot different than it used to. I want you to pay attention to this, okay? The state where your patient, your referred patient lives. This is not about where your site is and where you're referring from. It's about where they live. And we have this drop-down menu of 20 states. These are all the states that RVO Health, quit services provider. These are all the states that they serve. And you will see we have Washington, D.C. here. They don't refer to themselves as Washington. They refer to it as D.C. So if you're in Northern Virginia or that area and you have patients from the D.C. area, this is where you would go to click on that to provide services to them. We have Maryland. There's also North Carolina. I think that's it in Virginia. The only state, we don't have West Virginia. We don't have Tennessee because I think they are served by other quit line companies or companies that serve, provide other quit services, and they are not with RVO Health. But if they are with one of these states, you can click on that because that is where the referred patient lives. But since we're talking about quit now Virginia, we're going there. So we've chosen Virginia as our state. And let me do something. We don't want to do that. All right, and so we want to confirm that our patient lives in Virginia. And then we can come here. And all of this is new, all of this is different, but I want you to, if you have not done this, it's not hard. We just had to learn some things about it. All right, so as I said, you can find yourself by your NPI number. You can put your facility name in, your address. Any of this should identify you. So I'm going to put in a new partner from for our quit line, and we're going to hit search. Now, what I learned was, and I think a lot of you have learned with this, is when you put your site in, you thought all of a sudden something was going to pop up. Well, no, it doesn't pop up. We have to scroll down and we have to find it, because one of the things I want you to scroll down, because I put in well aware, and luckily there's only one well aware, but if you are UVA or VCU or a Carillion or Centera, it might be a lot of sites. So I want you to be aware of your address, your phone number, anything here that identifies that it's you. Then we're going to click it. We're going to save it. And then you see well aware comes up here. Okay, so you know you're ready to refer. And so you need, this is all your patient contact information. So you can put all this information in, make sure that when they ask if they can send text messages to the phone number, you want to ask your patient if that's okay. If they say yes, click it. Primary language, everything that was on the old portal. Now it comes to select the outcome report, the type. So if you want it by fax, you want it to come back to you that way, fine. If you don't want one, I want you to want one, but if you don't want one, you can choose that, not answered. I don't know why that's not there, but anyway, I want you to give an answer. And soon, as I said before, you should be able to see secure email in this list. And if you want it by secure email, and I'm sure most of you will want that, I want you to click that. When you come here, we're talking about weekdays, when can we call you? When can the quit line call during the weekday? You have that. Now you can also give a time when the quit services can call you on the weekend or contact you on the weekend. And so that you have that. As a healthcare provider, they want to know if you can pre-authorize this individual to have NRT. So you get to say that, get to answer that. You confirm that everything here, you obtain the consent from the patient, and you tell them that you're not a robot, and you can click submit. All right. So I want to go back because it looks allow me to do that. I want to go back because I want you to see what happens. Are you still seeing this?
Yes, we are.
Oh, very good. I want to see want you to see what happens if you're new. If you would recall, when you signed up for Quit Now Virginia, you filled out a form, you sent the form to me, and I put your information in. That no longer has to happen. Sites can complete this form on their own. They can say that they're a new facility. They come here, they put all of their information in here, and then they can go straight to the facility contact information. Once you click save, it's going to take you directly to a referral site. So you can sign up and refer a patient all at the same time. At the very same time, nothing has to come to me any longer. So as you talk to your colleagues and other healthcare providers about this wonderful service that you have that you're now excited about, you can let them know that they can sign up themselves by going to Quit Now Virginia. Okay. All right, and we'll can put the link to the referral site in the chat if we can do that so that you can have that. All right. All right, so are we saying 3 clicks and done?
No, we're still on the portal.
You're still on the portal. Okay, let's see if we can get back. How about now?
Now we're seeing your presentation, but not in the slide show view yet.
How about now?
Yes, perfect.
Okay, all right. So we're still calling this 3 clicks and done because truly I couldn't come up with another name yet. And we're still doing the 3 clicks. We're still confirming that our patient lives in Virginia or wherever they may be from. And then we find our facility. And then we complete the patient form in its entirety. We hit click submit, and they are now referred. So we've been through this. So this is something that we're as a team are excited about, the Win Back campaign. And we all know that there are individuals when they're in your office and with you and you ask them if they can be referred to the quit line, of course, they're going to tell you yes. And so then the quit line or the quit services call and they kind of hem and haw because they're in pre-contemplation stage. They're still not really ready. But the quit line is no longer going to allow them to kind of like skate through. They're going to try to do everything they can to get that member or that potential member to sign up to become part of the quit services family. That's what we're going to call them. And so they're going, if they have any information, they're going to get in touch with them by phone, by text, any kind of way that they can, so that these people can complete their enrollment process and they can begin their journey of quit, because we all believe it is important that they quit. We believe that if they got in touch with the quit line, they really wanted to at the time, but they probably got cold feet. And so hopefully, you know, by us or by the quit services continuing to get in touch with them, letting them know that we're concerned about them and want them to move forward with their journey, hopefully they will do so. Now going to quit line or quit services reports, the reports are going to look very different. I sent you the reports on last Friday, I believe, and I'm sure you all were just as excited, but also like, as I was about it, because it's more visual now. The data isn't as data centric as it was before. We have data, but it's more about graphs and charts and that type of way of getting that information to us. And so I'm excited to see what the actual quit line report or quit services and fax referral services are going to look like when that comes out next month. And the reason that some of our reports have not come out, the referral reports have not come out, is because many of our members are still functioning on the Apollo platform. Because say if they started or called the quit services on January 28th, January 29th, and they signed up for a multi-call service, they still are working through their multi-call service. They have not transferred over to the Rally Health Services yet. And we want everybody to complete their experience on that first platform, that Apollo platform. So that is one of the reasons why we haven't gotten reports yet, because we're trying to get all of the members to complete that service. Once that is done, if they want to re-enroll in the program, re-enroll with Quit Now Virginia, they will now be enrolled on Rally Coach, which is a new program, which everybody else who has been on since February 1st, anybody who re-enrolls, as I said, will be on that program now. We're working on partner promotions. We had a promotion, but I love the text and the information, but I wasn't really happy with the aesthetics of it. It wasn't very inviting. So I have the Office of Communications and the graphic artist working on something that is more inviting for not only you, but also for our members. But the information you will receive is about, you know, what your patients will experience and what the referral process will be like. We also have ways that you can make referrals, what your expectations should be as a provider. And I'm always, always, always reminding you to ask, advise, and refer your patients to the quit services. And as for members, there's also going to be a flyer for them. And we will talk about, you know, what does it mean to overcome nicotine dependence, and what does a model of success look like, and how this program is tailored to their needs, and to, even if they're members of a population such as behavioral health, such as being pregnant and postpartum. So we want them to know that we have services available specifically for them. And to wrap things up, we want you to know that the Quit Now Virginia services will remain. Please excuse my phone. We'll also want you to know that the logo will be displayed in a variety of places throughout the member experience. The URL that we used to have to get to Quit Now Virginia will still be available, and you can still get to Quit Now Virginia. And I am going to please ask that you continue to be patient with us as we journey through this, because just as this is new to you, it is also new to us. And so I'm learning along with you as I'm trying to get you up to speed. I'm getting up to speed as well, and my team is getting up to speed as well. But I think overall, this has been a pretty good process. You know, anytime you do anything that's on a grand scale like this, you're trying to move 20 states into something extremely brand new. There's going to be some glitches somewhere, and we're still working through them, but in the grand scheme of things, I think we've done this pretty well. So that's what I have for you today. I thank you for your time and attention, and I'll be happy to answer any questions I possibly can. I know that there may be some things that I may not know, but I'll be happy to get in touch with our QuickDime vendor, our Quit Services vendor, and we'll find out, you know, what we can for you, and I'll get back to you. Nicole?
Yes. Hi, Rita. Thank you for all that information. I know there are some things that I kind of learned and got clarification on. So I'm
Cool.
so glad we had this.
Yeah.
And just a reminder for everyone, I know this is a lot of information that I'm sure everyone wants to kind of go back and look at and refer as well. So we will have like the PDF slides, we have the recording as well. So we should send a follow-up email later this week, or if anything, early next week as well. And then again, all of our recordings are on the Tobacco Free Alliance of Virginia YouTube page,
Yeah.
if you have any questions. So Rita, I have some questions that came
Right.
up.
Let's
So
go.
first we have, let's see, when you were talking about the different new services we had, you talked about Coach and Coach Plus, and you talked about group sessions. Do you know, and again, you might not know, which is fine,
No.
but for the group sessions, do you know if there's a set schedule to it, or how that schedule looks, if it's like once a week, or do you know any specifics
Don't
about
know, but
that?
that is a good question, because, you know, since group sessions are so new, uh,
Yeah.
I don't know, but thank you
Okay.
for that, because that was a question I would never think to ask. So
Mhm.
I will find that out for you.
Yeah, I think that'd
Your
be good
schedule.
too.
Yeah, okay.
Yeah, because I think people like that. Some people like one-on-one, some people prefer
Mhm.
that group session for that different environment. I think that definitely helps.
Okay.
And someone asked if someone can self-refer, because I know you talked about referral sites, and you can sign up 3 ways. Correct me if I'm wrong. So we have the website, so quitnowvirginia.org, which is our new landing site. That's really easy to use. And again, that's not just for someone who wants to refer themselves. It also has info if you want to register as a referral site, or if you want to update. So it kind of has all of our information on it. So that's the first way online.
Mhm.
2, you can register 100 Quit Now, correct,
Right,
on the phone.
right.
And then 3, a new one, you can text READY to 34191.
Exactly.
Did I cover all of them?
You did good. Thank you.
Okay, perfect.
But you know, I think you can refer yourself, because on the referral portal is something that says, I am not a referral site. I am not a healthcare provider, something like that.
Oh,
And I've
okay.
not heard anybody say that you can't refer yourself. So I think that you can, because anybody can sign up now.
Yeah.
Isn't that
Rita,
cool?
can I add to that? I think that
Yeah,
if you know that would help you. I mean, the reason we have the referral site is it's an evidence-based program
right,
to build off that connection when you're talking to a patient or a client, and then that quick coach will call you within 24 hours, which we're so excited about that time
right.
frame. And
Mhm.
if you know that would help you too, refer
Why wouldn't
yourself.
you?
Or if
Yeah.
you're meeting with someone and their partner is there, and maybe their partner uses tobacco or nicotine products, you can refer them. The quick coaches will figure out what services, how much NRT that person is eligible for, but please refer them. That's really great.
Yeah, and that opens it up to a totally different population, right? Because at
Yeah.
first, you know, until now, it was only healthcare providers that could kind of like get you into this. But now, you know, refer yourself, as Sarah said, refer to folk around you. Why not?
True.
I like that. Mhm.
And to go off of our question before about group sessions, I know someone asked, can you request for only group sessions instead of one-on-one sessions? And so they can choose. Do you have to do one-on-one coach
I've
sessions?
not heard that you have to do one-on-one sessions. And I would think if it's open to, I mean, if group sessions are available, I would think that you could do all 5 group sessions if you wanted to.
Yeah.
If that's
I
the
think
way you
that's,
want to do your quit.
yeah. And it's probably one of those like personalized things. Like again, like each quick coach will talk to the person, figure out, you know, what's your preferences, what'll work for you, and they work with you to create your quit plan. So I would think you can do
I
only
think so
group
too.
sessions because I feel like I don't think I would like group sessions, so I would do the only one-on-one
Right.
sessions.
And some people
So
want to be with other people because they need that support. And if that's what
exactly.
you need to get you where you need to be, then I think we need to accommodate you in that way.
Sure.
Yeah.
And then someone asked for that text number again. It's ready to 34191. And I can copy and paste this in the chat in a second, but just wanted to answer that. And someone is very excited about our new services and asked about new information like materials. So we're currently working on that right now, right, Rita?
We are,
Okay.
Gina and I are working hard along with you all on, we're getting ready to revamp the brochure. That won't be tomorrow. Let me just let you know that everything is a process, but we're working on that because the brochure that we've had, it was a brochure that was here when I got here. And so now that the services are new and we're just kind of brand new all over the place. We got this new landing page. And so why not get a new brochure? So we'll be working on that. We just updated the Spanish brochure that will be coming in soon. Live a free brochure will be coming soon. So a lot of new stuff is coming. So I'm just so excited and proud of the work that we've been able to do, over the last 4 or 5 years or so, because we've just been moving the program forward and just progressing forward with what we believe the needs are and what we've been told the needs are for the program.
Perfect. So I have two questions about outcome reports, but let me real quick back up and ask about participants who don't speak English. So you don't want to talk about how we cater to different languages as well?
We do. We have a specific Spanish portal, De Hello Ya, that you can get your quit services. Also, we are connected with AT&T that provides all of our translated services in other languages. And so if you call the quit services or you refer to the quit service and we know you need another language, you will be connected to AT&T and then you will get an interpreted service by AT&T. So just because you don't speak English or Spanish, there are other languages that we certainly provide services for.
Perfect. And for the outcome reports, can you kind of talk about what those entail? Will you get information about how the client is doing? Like if, they're responsive to the group chat or if they're signing up for different sessions. And then part 2 is if a site is using fax referrals, and again, I know there's a new fax form, is there a spot to check that they want an outcome report for each referral? Does that make sense? And I can re-say that. Okay.
Let me go to the first one. The first question
Sure.
is what again?
What does the outcome report entail?
Okay. I don't think it goes as deep as what the sessions are, what they chose and all of that, because I have not seen the new outcome report. I have not indicated, they have not indicated to me it gets all of that. So it's basically what it was before. You accepted the call, you declined the call, if you accepted the call, you made a quit plan. But with these new services, it might, but I have not seen the new outcome report yet.
Okay,
so, but what I can do if one comes to me, because sometimes they will create something and send it to me, and if they do, I can always attach it to my monthly report and send it to you, so you'll have an indication of what that looks like. Okay.
Okay. And then still off of the report, if they are doing the fax referrals, is there a way to indicate on that fax form that they want outcome about that? Yes. Okay.
Yes. And I think it's laid out just as it is on the portal.
Okay. And then for the outcome report, how do they receive it? And you might have said this and I missed in the presentation. Is it via email? Is it How do they get it?
Well, now you can tell how you want it.
Oh, okay.
At this point, all will come fax, but they wanted to have, when we launched this service, they wanted to have secure email, but that wasn't ready. And so
Oh, okay.
secure email is coming. And I'm anticipating it will probably drop in maybe April. And so, and they will upload that to, the drop-down menu on the portal. And when you see it, if you see secure email, and if that's what you want, that's what you click, and that's how you should receive it.
Okay, perfect. So we're still working our way. We're just putting
We're
the
still
foundation first,
working.
right?
Yes, we're still working. Some of the residual stuff is coming, but in the grand scheme of things, we're in a good place. You can refer, and that's the main thing.
Perfect. And I remember when we had the paper form for people to register as referral sites, we also had a little box that said, that asked if they wanted materials like brochures and different things. Do we still have that or no?
On the portal?
Yeah, I
No,
wasn't sure. Okay. So if
no.
people do want brochures, you can reach out to any one of us, right?
Yeah,
Okay.
yeah, definitely. And that's what we want you to do. As I always say, we have all these materials, and we do not want them sitting around in our offices. And so if you need brochures, palm cards, anything, let us know. We'll be glad to get them in the mail to you.
Perfect. And then I have one more question in the chat is what are we doing to get the word out about this relaunch? And I know if you guys aren't part of our newsletter, we started a new newsletter last month that we've been working very hard on. And I'm working on the April one, and there's going to be a big shout out about it. And I'll probably I'm still typing it up, but we have a new newsletter for our partners. So you should be part of it if you get our Tobacco Free Tuesdays emails. If not, you can put your email in the chat right now, and we'll save that and add you to receive our newsletter. So right now, we just launched our first one in March, and then we have new things exciting, a lot of information for April. And then you can always forward that to your partners, and they can sign up to receive that themselves as well. So we're still working, trying to get that out. And let me see what else I have. Okay, hold on one second. We talked about this. And is there a cost to integrate real-time quit now outcome reporting into the hospital's emergency medical record? So we're still working on the reporting, right?
All right, let's make sure we're clear about what the question is.
Sure.
Are we asking whether or not the referral portal can be part of the EHR system? If that's the question, if that is the question, the answer to that is yes, there is a cost. And you would do that through the quit line or quit services vendor. That would not come through us. And I can connect you with the person that you need to talk to at RVO Health that can work with you on that. We have 2 systems that are working on that right now. I got an email actually this morning about that. And so, we want to see you do that, but that does not come through us, but I can certainly make sure you are connected to the person that can help you with that.
Perfect.
Okay.
And that's also a best practice. And I know like our partners, American Heart Association, also recommend that. So if you work for a hospital system, we would love to talk to you about that and share that information and connect you.
Perfect. And then one more question, I'll pass it off to Gina to kind of sum up everything. Rita, off the top of your head, do you know how many inpatient cessation programs exist in Virginia?
No, we don't, because systems can exist and they don't have to tell us. They can be in hospitals and behavioral health centers and whatever, and they don't have to report that information to us. And that's why the dashboard is so important, because that's another way that you can be in a group situation, or well, it's not in person, but if that's what you're seeking, that's the way that you can do that. But we just don't know. Now, we do try to collect as much information about that, every couple of years as we possibly can, and send it to the quit services vendor, so that if somebody asks about it and they have that information from the state of Virginia, from what we've collected, but we don't know all of them. We don't know the number.
Okay, gotcha. And sorry, one more quick question that just came in. Do you know when the new outcome reports will come in? Do you think probably next month? Because I know we used to have them monthly, so we're still just kind of
Are you
waiting.
talking about the outcome report or the referral reports?
She says outcome reports. Is there an idea of when the new outcome reports will come in?
I would say next month. I'm thinking April, everything should solidify itself.
Yeah.
Truly thinking about an outcome report. I think by April, because I think that the individuals who are on the old platform should have finished their services on that old platform. So by April, we should know. But if you're talking about the reports that I send out, your referral reports that you get every month, I know they will be out in April for February and March.
Perfect.
Get a lot of stuff from me in April. Just let
Yeah.
just letting you know.
Well, thank you so much, Rita, for all your information, answering those questions really well. And I know we had a lot of great interaction. So thank you, everyone, for your questions and excitement. And I hope, again, you all are excited now, not just 50% for all these services. So I'll pass this on to Gina to finish everything up.
All right.
Thank you, Nicole, and thank you, Rita. As you know, we are all excited about these new services at TCP and excited for you to start referring, because we know that Quit Now Virginia Services provides the best way that someone can quit using tobacco. So please refer your patients. Please sign up as referral sites. This is a perfect opportunity as we're introducing these new reimagined services. So Rita, a wealth of information, and you always organize it so well. And I know I'm looking very forward to the reports, because from what Rita sent out Friday, they do have a new look. You know, it's everything is visual, but I really liked it. I'm going to have, you know, really need to review them and go through all of the information, but you can really see a lot more just from the visual aspect. So excited to get to that too. I just want to remind everyone, our next tobacco-free webinar is April 18th. And this one will be very exciting for me as well. Tobacco in TV and movies. And as you're watching stuff, how often now do you see tobacco use, people smoking again in television shows? I'm going to give you a little homework this next month as you're watching, kind of to see if you see or if you notice people using more tobacco now. And we're going to talk about that with Jessica Rath. She's vice president of the Truth Initiative, and she's going to give us a very interesting presentation on how tobacco continues to be used in our movies and on television. So please join us. Please share this with your colleagues on April 18th for next month's Tobacco Free Tuesday webinar. So I will leave you with that. Enjoy your second day of spring. Enjoy your week, and take care. We'll see you next month.
All right. Thank you.
Bye.
Thank you.